Commissioner Chow
Present.
and Commissioner Chung.
Present.
All right, I will read the land acknowledgement. The San Francisco Health Commission, oh, I'm sorry, Commissioner Guillermo is not going to be here today. She is traveling and because of the flight issues is not able to, her connecting flight was canceled. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. Commissioner Chow, is it okay if I call the items? Would you prefer that today?
As the chairman.
Oh, I'm sorry. I was thinking we were on the JCC meeting. Commissioner Chung, would you like me to call the items or would you like to call them?
Please do call the items.
Okay, and I apologize. I was writing up the notes for Dr. Chow for the JCC, so my brain was in that place. Item 2 is the approval of the minutes of the Health Commission Finance and Planning Committee meeting of May 3rd, 2022.
I will move approval.
Okay, and I second. Do we have public comment on this?
There's somebody on the line. I'll just ask a person on the line, if you'd like to make comment on item 2, please press *3 to raise your hand so we can acknowledge you. *3. All right, I see no hands. So commissioners, I will take your motion and your second as an action, and we can move on to item 3, the contracts report with Ms. Ruggles.
Hi, good afternoon, commissioners. Luckily, I called Mark because I almost walked over to 101 Grove thinking we were back. Anyway, all right, I'll jump right in. There's a lot of them, as you noticed. And I provided some follow-up. I don't know if you've even had a chance to look at it, but I'll reference it, which was the questions that were provided. Most of them aren't really directly related to these contracts, but I did just, there's some groupings that might help speed us through some of these, but I'll mention that when I get to it. So the first contract before you today is a request to amend an existing contract that's come to you before for the National Research Corporation. The total contract amount is increasing to $5 million, and it's being requested to extend it for 4 additional years. And there's a lot of units of service and information crammed into the boxes, but the National Research Corporation provides patient and workforce experience surveys for the Department of Public Health that we are required to do, and I presume would like to do, and it's across the department. So this is a compliance, a contract to meet compliance requirements, and pretty straightforward, just extending what we've been doing.
Any questions, commissioners, on this?
Commissioner Chow?
No, it's pretty straightforward. So I had no questions on this, but I wanted to appreciate the breakdown. It was not only extensive, but really helpful in understanding the scope of the work that they're doing.
Thanks. Okay, the next contract is a contract for program administration with the Public Health Foundation, or sorry, Public Health Foundation Enterprises, DBA as Haluna Health. And this is for, again, it's an amendment, actually it's a new contract, but it's continuing the existing services. And the term of this contract will be a total of 5 years through June 30th or May 31st, 2027. So again, what this contract is, program administration and support services for the medical monitoring program. And that's a program designed to collect supplemental surveillance data to provide additional information to the department on HIV transmission, I believe. So I know we have a representative here to answer questions if you have specific program questions, but I think similarly, this is continuing existing services that you've approved previously.
So my question was, if this is a continuing contract, in the past you were able to tell us what the old contract actually, was expended, unless this is a new bid.
I think this came from a new RFP. I don't have information about the old contract. Perhaps I think it's Sharon Pipkin is on the line. Oh, is that you, Sharon? Okay. Hi, to answer.
Hi, Commissioners. Good afternoon. My name is Sharon Pipkin, and I'm here to answer questions regarding this contract for the medical monitoring project. And again, if I understand the inquiry from Commissioner Chow, this is a new contract. However, it's an existing program for HIV/AIDS supplemental surveillance within the city of San Francisco. So we are continuing with a very similar scope of work and deliverables for a new period of 5 years.
Yeah. I see now where it does say this was under a new contract solicitation. So appreciate that, and also appreciate that you gave the administrative fee breakdown. So I have no further questions on this one.
Thanks, Commissioner.
Okay. Thank you. Okay. The next contract is San Francisco Public Health Foundation. And this is a new agreement, and the requested, and it's on this report because it's Public Health Foundation again, which is an existing contractor. But the purpose of this program administration support contract is to provide COVID accelerating vaccine equity program management services to this department, to our department. So this is a 1-year contract for an amount of $840,000. And if you, and I believe we have a representative as well on the line, Jonathan Sears, I think. If you have specific questions about the contract.
Anything, commissioners?
Michelle, could you just remind us, this is a new contract, so it's not, but of course it's an old vendor, but we then don't write a whole new contract like we do for the other contracts that are before us? I'm just wondering, that's just sort of a,
Yeah.
it's not a continuation or a new bid, but for the same services. It says it's a new agreement with no previous funding.
Yeah, so it's a little bit of a gray area. We could default to always doing a new memo, but the new memo is going to be about the San Francisco Public Health Foundation, their board members, and that type of information, which you've seen, 25 times. We could do that. We opted to put it in here because it was an ongoing vendor. But I think the same information is provided with the exception of the board members of the San Francisco Public Health Foundation.
Yeah, I'd leave that to discretion of maybe the chair and the staff to find which is the easiest, and that we then would take that into consideration. So I think that's a good explanation. And Commissioner Chung, I think the question would be, what would be most efficient for the staff? But then somehow we should note that, well, I guess it does note it. It's just that as I wrote earlier to you all, some of these now, we have so many different categories that they become a little confusing as this is a new contract. We have a new, statement here. Now, if we're going to use that only for new contractors, and that's something we should know and just be aware of in our own thinking. And maybe this is because we've seen too many contracts.
I have.
So I don't know. I'll defer to the chair. I think you gave a good explanation as to what you're all thinking of doing, and I would leave it for us to look at the most efficient way.
Okay.
I have to say though, like with that said, I really appreciate, like the kind of investment we're putting into the equity part of this, I think that this seems to be, like a relatively, new approach to ensure that, vaccines get to the right people. So kudos to you all.
I will pass that along. Thank you. Okay. So the next contract is Baker Places, PRC, and I wanted to apologize and then at the same time pat us on the back in the contracts office. But if you look at if you have that supplemental document that provides the responses to the questions that you forwarded, at the very end, I tacked on number 7 just to provide information in one place and maybe help you for your report out. But so the department successfully, which has been huge, got 11 contracts to the Board of Supervisors this past month or in May. And so that was huge because when these were original agreements, when you approved these before, they were all retroactive, they were all late, and they all had a cash flow problem. So now we have 11 contracts that we got to the board, Baker Places being one, that were approved in the last, like Baker Places was approved May 24th. So we're super, like that in the midst of COVID is a super big accomplishment. The downside, the bad news is that the order is off because normally, and I can't think of any other time where it hasn't occurred in this order, we come to the Health Commission for board contracts first, and then we go to the Board of Supervisors. So of the 11, there's 4 contracts that are on this list. Baker Places, Community Forward had 2, and then Health Right 360 that have already gone to the board in the past 2 weeks and been approved. So I want to apologize for that. It just, it's like the timing didn't align, the capacity didn't align to get all those pieces in order. So this contract is Baker Places PRC. This is an ongoing contract. It's extending an existing contract. There isn't a change, adding 4 years at the same level of funding, essentially. And essentially meaning we have a contingency that would provide for a cost of doing business increase. It's a big contract, provides like 9, I don't know if all 9 are in this, 9 residential treatment sites, assisted independent living program, which has sites for, co-ops, and it also has a lot of outpatient and substance abuse treatment. So this is a big contract approved by the board. What I want to say is that it's not going to be here today, but I want you to know that it'll be in the future, like maybe in July, that PRC has come up with or has been presenting significant cash flow issues to us, which we have been working. Actually, it's very emerging because it's been hard to come with a number, an amount that what is the amount, what is the problem. But now that they've come back with an amount, there's this whole other side process that's going that involved the city attorney And so that will come back to you in July. What the department is proposing, or the Board of Supervisors actually will be proposing for to help them with their cash flow issue. But in terms of this contract, and the reason why this contract is here and the reason why it went to the board is, one, that the cash flow issue has been emerging, and it's really only now exactly being, in the last couple of weeks, being quantified and a plan in place. But these are ongoing services that are filled. The residential treatment programs are filled. So not continuing the contract would put all those beds at risk, those clients at risk. We wouldn't be able to pay them because this contract actually expires June 30th and requires the amendment to extend the contract. And because it's over 10 million, it goes to the board, and that's how that happened. So, so that's why it's still on here, and why we have kept the same, why we didn't change it. Because if PRC, which we hope isn't the case at all, goes south, then we have contract remedies for assignment and assumption. We would try to retain the same contract because we definitely don't want to lose the licenses to the residential treatment programs. So I just wanted to say that, so that you don't like, why did I approve that? And then this other thing comes up. But in terms of just the contract and approving their ongoing services, sorry, I can't turn my phone off. It is the same as what you approved last time.
So you're sort of informing us that there is some sort of cash flow problem here, which you will bring in July to resolve, but that we need a contract, which the board has already approved, in order to maintain all these beds. Otherwise, we would actually also have a possibility that we would lose licensing also.
Well, I believe, and this I'm confirming though, but I believe that the license, you get cited. There's a Medi-Cal certification process by the state that goes with the vendor. And I think if the vendor closed and we didn't have a plan in place, that I'm assuming there'd have to be a reapplication. There certainly would be changes to the Medi-Cal certification. So until we work out all those details, it is in our best interest to keep the current mechanism going. And hopefully it just goes anyway. It doesn't, but I just wanted to bring, and your summary was exactly correct.
Sure.
And I wanted to just say that, I've been around long enough to remember that there was once upon a time when certain facilities, lost their licenses with us because of the Equal Benefits Ordinance. And, and so they lost their residential programs. And because of that, there were actually, someone who overdosed because, they were not, in a supervised, residential setting. So we definitely don't want that kind of things to ever happen again. Yeah, and I totally appreciate, what you just said, Michelle, that, that it's, yeah, it's it's delicate. I think that's the word that I'm looking for. Yeah.
Good word. Yes.
Yeah, and I think we appreciate the transparency, and if I'm sure the chair would properly indicate that to our commission as we pass it, because then when you come back and tell us later that there is this problem, we'll say that we were aware of it, but we certainly cannot afford to lose these beds, especially with the initiatives that are now going on. So,
Right. Okay. Thank you.
Thank you.
thank you.
Okay. So the next contract is Bayview Hunters Point Foundation. This is an amendment to a contract that you have approved before, and it's continuing the same services. Essentially, what's happening here is that we are adding 5 additional years and the corresponding funding that goes with each year. Don't think there's a really, we have a representative if you have questions. I'm not sure there's anything, well, I won't just, if you have any questions about the programming, please let us know. And this will be going to the board and you are getting it before that, so.
I think this one's clear. The word amendment and the proposed amounts and all. I think this is working fine. And for me, the information you provided, except as you had pointed out, having the units of service detached makes it a little hard to read. But understood your explanation of staffing and the need to do that.
And on that note, I'm extremely happy to report we have a new, hasn't started yet, behavioral health services contract director, Phil Mock, who will be coming over from another contracting unit. And then we'll have Dean Goodwin is going to be supervising the 2 contract units. And so you'll probably have the privilege and pleasure of having Dean presenting also at the Health Commission. So there's more help on the way. So these things we won't be pinch hitting in pieces. But okay, so the next contract is Community Forward San Francisco. This is this contract is for their medical respite program. This is also one of the contracts that was approved by the Board of Supervisors on May 17th. So this contract amendment, you've also approved this contract before, and the amendment is for 2 years, exercising the options through the term of the lease. The term of the RFP authority, solicitation authority. So we'll be putting this, reissuing a solicitation to coincide with the end date. This is a program that's a partnership, very much a partnership with department staff and community forward staff, where the department provides the clinical staffing and community forward. San Francisco provides the operational support of the programs. Community Forward really stepped up during COVID and provided a COVID-19 respite sobering center. And if you want to know anything about these programs, Dara Apo is on call. It's on here.
I didn't have any questions of the program. I was actually curious when they changed their name. I knew them under Cats for years and some of the board members. So was there a reason for the name change, or they just wanted to be more modern, or what?
I don't know. If anyone on here knows, they can jump on. It's been a few years though. We still keep it there because, right? Some people still think of it as Cat. Oh, hi, Dara. Do you know?
Hi. It was rebranded in November 2019 when they had a new executive director come in.
I see. Okay.
Credit goes to Alice Montgomery, the nurse manager, for knowing that off the top of her head.
Thank you, Alice.
All right. Thank you.
Thank you.
Okay. Any other questions on this contract?
Not from me. So I think that's pretty straightforward. We can move on.
Okay. The next contract is the second Community Forward San Francisco contract. This one also went to the board. And this is their behavioral health services contract, which is mental health and behavioral health, mental health and substance abuse. You'll notice that this contract extension is essentially a year, or it's only through June 30th, 23. And the reason that contract is shortened is because they have 2 locations, a women's drop-in at one site and a women's shelter at another site, and they lost their lease for a women's place drop-in. So in the next flurry, there's a lot of flurry of activity. Next period of time, they're going to be looking at solutions. And so the idea here of the shortened lease is once we have a solution, then we'll come back to you. But the staff, those two programs are actually closed. And right now, all the staff are relocated to a COVID site 11, or AKA Nob Hill Hotel. And so they lose their lease June 30th, but their services, but their staff, that program is still open, the SIP Hotel, through the middle of August. So there's just a little whisper of breathing room. But we'll come back when we know and amend this contract. Because once we know, we'll also want to take it back to the board. And so we'll come to you first to share with you what conclusions, what will be done. But other than that, the contract that is before you is set up, and it continues existing services as if they're two programs, and budgeted for two programs. And we literally learned at the board meeting that their building was sold, so there hasn't been time to know how to redo anything.
So I think that I'm more interested in understanding, like where they are now. So they've closed the shelter and drop-in centers in their like usual locations on Howard. Is that?
They closed them. I don't think the shelter closed immediately, but eventually, because during COVID, they closed both of them. And their staff all relocated to be the operators and staff of, originally it was 2 shelter-in-place COVID hotels, and then it became 1 shelter-in-place COVID hotel. And they're still there. Community Forward is still operating that hotel. So in an ideal world, the hotel ends, the city's lease for that hotel ends August 11th, and then they would reopen their new programs. I mean, not their existing programs. The challenge now, of course, is that they only have 1 site. It's at 1049 Howard. So, there's like short term, intermediate term. I think they're looking at a lot of things that their ideal world, they would get a long-term lease at the Nob Hill Hotel. And so there's just a lot of, it's expensive though. So there's a lot of little pieces that need to be ironed out. But so the programs aren't newly closed. They've just still been closed because of COVID.
Yeah, so that's more of my curiosity, because I'm pretty familiar with Women's Place and the good work that they've been doing,
Right.
especially for the trans community as well. So
yeah. So it's a top priority to keep it going for the department.
So the programs themselves were at the shelter in place then, or they were reassigned different tasks because of COVID?
I think that they opened the shelter in place hotel, and I believe, but if Dara Papa wants to jump on, I think that they moved many of their existing long-term clients from their programs to the hotel. And so, but their job role changed, and that they were operating a SIP hotel. So and I'll just turn that right over to Dara to speak about any of the differences and what that means.
And sorry, just to confirm, was there a certain building that or is this just their general shelter in place aspect of Community Forward's contract?
Yeah, what changed when the staff moved over to operate Site 11 and 6 from their current operations?
Those were sites that I think, and again, a little bit out of my sort of day-to-day Community Forward work, but those were sites that were, because the existing shelter is closed, I think as Michelle said, the patients moved over there, some of the population expanded to sort of ensure that they had individuals with high levels of COVID vulnerabilities. the work of the staff stayed relatively the same. It just sort of kept the services moving forward in a way that was safely socially distanced in the different settings, like happened with so many other shelters.
Oh, okay, thank you.
Thank you.
Okay, the next contract is Health Right 360. We've labeled this combined R's and regular, but I think we can probably ditch that. That is such dated when they took over Asian American Recovery. So, but any case, this is the behavioral health services contract. This also went to the Board of Supervisors and was approved May 24th. Again, this contract is continuing existing services through an amendment. It does expire June 30th. The amendment allows us to continue the programming. So they provide the same programming, but residential substance abuse and mental health, outpatient services, and residential step-down beds, which are accompanied by intensive outpatient services. So again, continuation of existing programming.
So, of course, these services are important. Just trying to figure out, I didn't really multiply it. I just saw now that the increase is about $700,000. So I'm not sure. Is that's just 3% of their total?
Yeah,
I
it
guess.
is. I know. It's hard. It's
That's a
high,
huge
isn't
amount.
it? It is high. Or I mean, it's not high, it's a lot when you look at it that way.
Right, and technically, the problem of having the title on one page and then the rest of it on the other page it is a little problematic just from a reading standpoint. But
Yeah, so we won't do that again, and we'll have more staff to make sure that everything can get done together.
okay, otherwise, I didn't have any other questions on it.
Yeah, I don't have any other questions either. So this is just an amendment to continue existing services for another 3 years. 3 years, right?
Right.
Okay. Yeah. All right. Thank you.
Yes, 3 years. Okay. So the next question, the next contract, I think, now that I'm looking at it, this is an existing vendor, but I think we could just make a decision that if it's an existing vendor for a new in fact, we may have already made this and didn't do it, but an existing vendor for a new service, we can just do the memo and then, but what this is here, so this is 3rd Street. It's a new grant from the Mental Health Services Act. It's 1 year only. And so it's a retroactive contract that we're trying to get into. Oh no, this one isn't 1 year. Sorry, I'm mixing up contracts. This is 3 years and 8 months. This is we're using the grant agreement that we talked about last month. And what this contract will do, and I will turn it over also to the representative for this contract, but this is with 3rd Street, and they will be providing support at existing wellness centers that are operated, and actually this is an error, it's written operated by Community Behavioral Health Services, but these are really primary care operated wellness centers, and 3rd Street will be adding their services to these wellness centers to provide behavioral health services. And I think we have, sorry, I didn't write down, that Sharon? Can't, is speaking to 3rd Street? Okay, well, if you have questions, I'll see if I can answer.
It should be Heather, but I don't see Heather here.
You know what? It's not Heather. It was someone else that Beth sent. Beth Neary. Well, do you have any questions about this contract?
I was just noticing, and thank you for your first discussion that maybe it was only 6 months, but that raised a different question. My question now is actually related to at the 3 years. Uh, it says there are 30 clients, so that might mean that there's only 10 per school. I mean, just as an average. Or obviously, if it was different, there'd be even fewer at certain schools. Uh, so it only serves 30 clients. I mean, what I kind of envision the idea of the school programs, and we've been talking about this for a long time. And it's nice to know that we have a presence in some of our schools and presumably those that have the highest need. But if they did, this seems like a very small number being cared for in this manner. So, not sure if they do treat if this is only 30 clients for 3 schools.
Okay. Is Carol on the line or Shannon?
Shannon Worth?
Yeah.
Oh, I can get her on the line. Okay, I just put her in the meeting. Can you say that again? Shannon, I'll unmute you. Can you, I'm not sure if you've been hearing the question. Can you
This is
respond?
Shannon Worth here. I have been listening and do hear the question. The behavioral health clinicians usually have a panel of 30 students that rotate for kind of short-term therapy. And in this contract and grant, we'll have 3 behavioral health clinicians at 3 of the different high schools at Burton, 2 high schools and 1 middle school, Burton, Willie Brown, and Balboa.
So you're talking about short-term rotating. So there are more than 30 people involved then.
There will be more than 30 people involved, yes.
Is that 30 are involved in each of these short-term sessions?
Correct.
Okay, do we know how many per year are then served?
I don't know off the top of my head. I'm so sorry.
I mean, that's what the usual count is that we'd like to see, is how many people are served, not just how many people within the short sessions. That's okay. You can, but you've clarified it isn't 30 people only throughout the whole year. Thank you.
Thank you too. I that. Okay. Good to move on. Okay. The next 2 contracts are labeled as they're both part of the substance abuse overdose response team. And these are new contracts. They're retroactive, but they've been doing startup costs, but haven't started delivering the direct services yet. And these contracts were kind of complicated to get started because there's new programming that we've never done in the city before, and they both have to use Epic, and that's not business as usual for behavioral health vendors and getting them set up, and then combined with new city requirements about cyber. So this has been a complicated process to get going, but so what you have is RAMS, Street Overdose Response Team, is how it's labeled, and this program, and so what RAMS will be doing is working both actually for the substance abuse response, overdose response team, SORT, and the Tenderloin Linkage Center. And so in all cases, what they provide are peer counselors. And in the SORT team, they actually go out with the responding to 911 calls as the peer counselor. And in the Tenderloin Linkage Center, they are peer counselors in what's called the TLC Living Room program, making linkages and connections with the people who are at the Tenderloin Linkage Center. So, yeah, and I guess I'll just say this, and then we can come back to harm reduction therapy because it sort of goes along. The Harm Reduction Therapy Center is also part of a team membership for the SORT program, but they're involved in the post engagement response team. So after you have survived and not survived, then this is where this team will pick up to provide linkage. So the Harm Reduction Therapy Center provides the harm reduction therapist, licensed or licensed eligible behavioral health specialist, and the RAMS portion is the peer counselors. And so each of these are new contracts. Each of these will be going out will be solicited. And the reason that we didn't contemplate it would take this long to get them going, but there's just a lot of obstacles in the way, including COVID. But it was determined that to start these contracts would be faster because we could expand the services that these vendors already provide. So they have the infrastructure, like RAMS, for instance, has a peer counseling certificate program. So they have a training program and therefore access to individuals who could be assigned to work in these, to support these two contracts. And so anyway, so that is why I think you'd asked a question why they were sole sources. And so both of these will be going into our new grant agreement template that we talked about last time. They each are approved under a sole source, and the sole source is simply to get them started, test this out a little bit, and then in fiscal year 20 next year, like a few weeks away, we'll be at some point preparing the solicitation, issuing it, and then getting our ongoing vendors by January 1st, 2024.
So both of these are part of the SORT team, and that was a very good explanation on your part. One sort of takes care of them earlier and the other later. And I note that you have called these new originals, so maybe it's up learning the definitions and maybe lumping new originals and amendments together so that we can sort of figure out what we're doing with each of these contracts. I was just thinking back to our earlier conversation. If you found using this format gave you more efficiency, then we might just use these definitions like a new original or amendment and then maybe have them in that fashion doing the amendments and then doing the new originals. Although I noted that you did answer, thank you for trying to get us an overview of all these behavioral health programs so that we would know where they were getting slotted, right?
Right.
And that would be very good. As for these two specific programs, you gave a good explanation as to the fact that these are startups and a pilot, and I don't have any questions about that then.
And the only thing I want to just correct, because now that you mention it, now that I'm staring at it, it says behavioral health services. So of course that's a component, but both these programs are run under whole person integrated care under DARA PAPO. So, but regardless, I still think to back to one of your questions that we definitely should create something like you had for EPIC, like here's mental health SF and here's how these new services fit in. And it could be mental health SF and new initiatives by the mayor, because the mayor is the one that started this substance abuse overdose response.
Right, and that I think would be helpful, and then us sort of learning these new definitions, and then maybe grouping the contracts as for review by amendments, by new originals, or by continuing originals, or whatever.
Mhm. Right. Okay.
If like I say, I think we need to be sure that we're being efficient for you too, and not creating a lot of extra work.
Okay. I'll circle back. I'll talk to the staff. I think we get used to just using this for the CBOs, and so sometimes like, oh wait, yes, it's new, and what's the definition of new? So I'll circle back with the staff and to see what they think, and then I'll circle back with Mark, and then have a conversation and see, because maybe it's just easy. Well, anyway, we'll come back to that.
Yeah.
But
Yeah, and I think I would check
Present.
with our chair as to within
Yes.
the dialogue.
Exactly. Okay, so the next, we go in order. The next bundle of contracts are Seneca Center, Victor, A Better Way, Alternative Family, Catholic Charities. Each of those contracts has been to you before, but a few years ago. And so what has happened is often we have larger contracts and we do an RFP and we add the services and they keep getting bigger and bigger. But and so what's the deal with these 5 is that the RFP that authorized the services, called Continuum of Care Reform, expires June 30th, 22. And so a new solicitation was done to continue the existing services. And so it's even called the same thing, Continuum of Care Reform, RFP 3, 2022. So what this is it pulls out that piece. In some cases, it's the entire contract, but so the services from Continuum of Care Reform, they're all described in each of the blurbs, but they're not new services. They are continuing services, but they're going to have their own contract, and actually they're going to be in that grant agreement. But they're all authorized by a new RFP. And when we originally did this back in 2017, the state had mandated a change, making more services Medi-Cal eligible. And as a result, they required new services to be added to the continuum of care for children's services and behavioral health. So it's treatment, foster care, short-term residential treatment programs to replace like long-term group homes, therapeutic visitation services, intensive care coordination, and child and family teams. So depending on what a vendor, one of these 5 have been doing, they're continuing what they've been doing. So specifically for Seneca, this is a 5-year contract for this service. And this service for them is intensive therapeutic foster care and their intensive therapeutic foster care program, and then their comprehensive assessment and stabilization services program, which they call COMPASS. And they're ongoing. So I think I'll explain, but if you have questions, I believe Allison Lesbader is on the line to answer any other questions.
I don't have a question on this.
Just to say on Seneca, this is pulling out a piece. So now going forward, Seneca will have 2 contracts. And you actually recently approved the big one, and that went to the board without these services. And so Victor Treatment, next one, is just like same situation. The difference is that they provide a short-term residential therapeutic program. And their entire old contract will end and be replaced by this new contract. Just make sure I didn't say that wrong. Yeah. So That's what that is.
And these were all out for bid, right? Yeah, it's under an
Yeah.
RFP. Okay.
Yep. I feel like that was sort of a miracle too. The RFP was done before the contract expired. But, and the next contract is called A Better Way. Same thing. They'll end up with 2 contracts because the only part of the service, because the outpatient is continuing in their original contract, which you've approved. And then this contract under Continuum of Care Reform is the therapeutic visitation services. And that's what is funded here.
So the therapeutic visit is the new contract,
Correct.
and the other is a continuation that we have.
Right.
Okay.
When you first approved Seneca, A Better Way, you approved these services and their outpatient services, and now we've just pulled out the therapeutic visitation services.
Okay. I don't have questions, Commissioner Chow.
Yeah, no, thank you.
Okay. So the next contract, same deal, same RFP, alternative family services. This will, just like the others, be a 5-year contract. This one will have a continuing outpatient contract, and this will be the new contract under this RFP for therapeutic visitation services and treatment foster care services.
Yeah,
It's pretty straightforward. Like, yeah.
I guess my just reading the requested action goes back to what I had mentioned earlier. Maybe by these categories, we just need a better, or us need the definitions, because these now say new, original, and continuing services, and you've also described new services, but that's somewhat different from continuing services period or new contract period. So
These are all existing services that are continuing.
okay, but didn't you mention that you were adding new services
I think,
according to the Medi-Cal requirement?
or is it
Oh, sorry. You
existing
know what?
services with a new contract?
No, yeah, sorry. If you look at question number 8 or number 8 in that document that I provided to you, I was
Yeah.
just giving you the background. When this first went out to bid and this service first developed, it was in 2017. So we did an RFP then to meet the state's new requirements, created contracts, you've approved them. That RFP though expires June 30th, 22. So we're just continuing the services. Sorry, I was just giving you the old background. So these are the same services continuing.
Oh, okay. All right. They're not adding these new blocks.
No.
Yeah. Okay.
Yeah, so they're exactly the same service.
Oh, all
No
right.
change to anyone.
Gotcha.
And then, okay, so then Catholic Charities, St. Vincent School for Boys, that's the last of the 5 contracts that are part of the same solicitation, same deal, 5-year contract. It's continuing their existing short-term residential therapeutic program. And they had that in the last contract, and that's all we fund them to do. So the old contract or the current contract will end and be 100% replaced by this contract.
That just was just for my information. What is short term in terms of residential treatment?
I think it's 3 to 6 months, but is Allison on there, Mark?
Okay, Allison, I can't move you into the meeting, so I'm gonna unmute you. Can you speak to us, Allison? Because I can't get you in the meeting to show you, but you're on.
Yeah, can you hear me?
Yes, go ahead.
Oh, hi. Short-term STRTP, short-term residential programming, is a residential program that is designed to have kids from 3 to 6 months. It was developed in response to the fact that the state thought kids were staying in residential treatment longer than they needed to be. So they relooked at it and redesigned the programs to have them be shorter stays, with the idea that the kids would then transition into more family-like settings, with the team that was holding them in the residential treatment center following them into the next level of care.
So has that been successful?
Well, quite honestly, the concept was a really great one and would have been successful if they could find enough people to run them and staff them.
But we're still funding it.
Yes, because we believe in it. We believe in it, and we don't want to not fund it. And the ones that we do have contracts with have been successful. I think overall the state is, struggling to try to get more of them.
Oh, I see. You were talking about in general the whole concept, but our contractors you're finding are effective.
Yes, our contractors are very effective, and we really support this model and want to support our contractors.
Okay, no, thank you very much.
And so for this service, what are what's the range of ages that they serve?
They serve, well, they're supposed to serve 6 to 18, 7 to 18, or 7 to like 17 years, 11 months. Because once you're 18, you can't get admitted into them. Then you go into an adult facility.
So, but if you're in the facilities and turn 18, what happens?
Then you can stay. Then you can stay.
Okay.
Then you can stay. I'm sorry. Yes, then you can stay. It's about admission.
Okay. All right. Thank you.
Okay, believe it or not, the last contract on the contract report, this is Positive Resource Center. This is an existing service. It's not changing, but it does require going out to bid. And we just don't have enough staff and haven't had enough staff. That's hopefully changing. But we weren't able to get the solicitation completed by June 30th in order to put the service out to bid. So what we're doing is a 1-year contract that will allow us to put the service out to bid and to ensure the continuation of these services. This is a very helpful contract for the client first and foremost, and then for the department in that it ensures ongoing reimbursement for eligible services. But what this contract does is they have a legal team and maybe others that work with individuals who have lost their insurance or benefit or are trying to get it back or trying to get it in the first place. And the hurdles and the complexity sometimes is too high for someone on their own to manage. And so that's where this really important support comes in from PRC. So that's why it's a sole source waiver for 1 year to allow us to complete a solicitation.
And this is different from the one that you spoke of earlier for PRC in terms of their cash flow issue, or?
The one before was Baker Places, right? But it's under the same umbrella.
It's under the same umbrella, so it's the same. Yes, that challenge is to the agency, and this is a second contract that we're just treating. I mean, this one's shorter; it's 1 year, so this is a bridge. This is like slated to go out to bid, and at this point, we're not aware that specifically that there are cash flow issues will specifically impact this contract, but we'll know more, or I'll know more soon.
Yeah, this actually also bring back up that subject that we've talked about, with a lot of different programs merging, and and so the entity is getting bigger, and they are continuing the services that we have contracting them for, but but the cost of running them looks different. And yeah, and and we are we going to go into that whole like too big to fail scenario again?
Yeah.
Yeah.
I guess that might be what would come out in terms of their discussion next month about what's going to happen. But I think Commissioner Chung has been speaking about that for several years now, and
Yeah.
it just seemed to get bigger. I mean, these are enormous numbers for agencies, and when they're combined, I think we have that concern.
Yeah, and a majority of them also rely on government funding. That's the other, challenges. They don't have any other revenue streams. So yeah, so that is another challenge, so yeah, so it's just I'm really concerned sometimes, like when I hear that, oh, like it got bigger, like, oh, so it's no longer one house, no longer Haight Ashbury Free Clinic, now it's Health Right 360, and yeah, and things like that. So
And the pandemic has not helped at all. Staffing,
no,
and it's hard to do fundraising, and yes, so.
Well, I'm wondering we took that subject because perhaps the whole Baker Place thing might become a good point of departure to review how big we want to have agencies, especially most of the funding being government generated, because this can be the a vicious cycle. They're too big for us to have failed because they're important services, and yet there's insufficient funds, and we just keep going around in circles about how we're going to then either give them stopgap or forgive this or what, which doesn't really lend to fiscal responsibility either.
yeah, so that's exactly the point, is like the business model, we need to like really like take a deeper look into the business models of merging, because these are social services. These are not like big corporations like Coca-Cola or or some other like Fortune 500 companies. So yeah, so I think that like that's what we need to think about, and the other concern is, like if they are all merging, like, and we are going to just like use the list, like the sole source list, like to like move forward with some of these contracts. What does that mean, like, and would that make us fiscally irresponsible? Like, so yeah, so I think that those are the conversations that we should find ways to have.
Commissioners, thank you for your comments, and I'm wondering if you feel like this could be a full commission discussion, since the other commissioners don't really delve into this, and all they're doing is kind of seeing consent calendar and not talking about these issues. Because I'm hearing concern about too big to fail agencies, and then mergers, and then also just in general fiscal responsibility and contracts. So maybe I'll talk offline with you all, and then loop back with Ms. Ruggles and Mr. Wagner and Ms. Louie and just try to figure this out. So, because I'm hearing that this sounds like it's an item, but let's figure out whether it belongs to the committee and or the full commission so we can get the biggest bang.
That sounds great. I still remember, like way back when Continuum and Tenderloin AIDS Resource Center merged, and and what happened, and some of the consequences, like because of that. And then, like we have merging of like Lion Martin with Health Right 360, and now they separating again. So that's a lot of these going on, and I'm here to be a public health commissioner, not a like financial analysis or a business analysis. So I like to get more educations on, like what kind of impact those actually have on the communities that we serve.
Thank you. I won't take up more time of your time today, but I'll check in with you both on this. Thank you so much.
Well, I just wanted to put into your mind, Mark, as you look at this, and it might require that certainly the commission needs to hear it, but one can do preliminary work before with a smaller committee trying to ask some of the questions and see if we can then bring a story to the commission. Because you might remember, all of us who are here long enough, and you have been, that we were at one time encouraging that very small agencies would sort of get together because the administrative costs and the administrative expertise needed was lacking on well-meaning but very focused agencies. And so some of the mergers seem like this would be helpful because those agencies could continue their work and yet not be burdened by the difficulty of resources for administration. This just seems like we're running. It isn't quite the level of Coca-Cola yet, but so somehow there's got to be some sort of a balance here, and maybe the Lion White separation is another example. I don't know, but we should find out then within this how successful we have been, that the focus has been maintained as these have merged. So it's not just fiscal, but it would also include programmatic and the ability for these smaller agencies agendas to really be championed by the larger agency.
Yeah, I think that we also have enough data now, like since all these have been happening, whether these merger actually promotes more services being offered, or actually it led to, like a reductions of like services. So yeah, so I think that those are all part of, the things that we really need to like consider.
Thank you all, or thank you both very much. And so I believe we're at the end of the contracts report. Ms. Ruggles, right? Have we?
Yep.
So,
That was it.
and so please let us know if you are ready to make motion to put this on the consent calendar and recommend approval.
I'll make such a motion with thanks to Ms. Ruggles for what is a very extensive presentation here of the many contracts.
And I will second.
Thank you. And I've got a couple people on the line. I just want to make sure that, I think their staff are here to support staff. Folks in the line, if you'd like to make comment on item 3, the monthly contracts report, please press *3 now so we can recognize you. Again, *3. Okay, no hands, so we will take your motion and second as an action. Thank you so much. The contracts report is put on the consent calendar. Let's move on to item 4, a request for approval of a new contract authorized under section 21.15 of the Administrative Code with Health Management Associates Incorporated.
And I will turn that right over to Baljeet.
Thank you, Michelle. Good afternoon, commissioners. Secretary Moritz, happy to be here. So I did receive some questions particularly from Commissioner Gerardo, that I would like to just make sure I can address in session. But overall, Health Management Associates is partnering with the Department of Public Health, particularly around our efforts as we work to recertify Laguna Honda. And Health HMA, as they're called, is working specifically on on two different items. One particularly is a comprehensive assessment of the facility, and to be totally clear, the comprehensive assessment is called out and specifically defined in the contract. And for the sake of this conversation, there's some key components that are called out. I won't read it out entirely, but there are some significant phases, which include an assessment and baseline measurement. It includes a stakeholder interviews across the entire continuum, non-clinical, clinical staff, patients, the medical staff, hospital leaders, health network leaders, and DPH leaders, including our governing body. So it is certainly very extensive. It will also include assessment of current care models, coupled with best practice research around what a skilled nursing facility operation that is evidence-based and with best practices, what a highly functioning and SNF looks like related to the optimal and the excellent patient experience that's provided in the safe environment that we continue to promote. And finally, there will be also coupled with recommendations for everything I just described that bring us to either align or exceed the best practices that we currently see now. So really excited about that component of it. And then the second component of it is, you know, the partnership to help work us through the actual recertification process itself, which includes survey readiness assessments, mock surveys for preparation, want to get an assessment of where we are, opportunities and ongoing coaching around opportunities and gaps, and including a second mock survey to ensure that we are ready, and then we are ready, their partnership and guidance, and then submit the recertification applications to get us where we are headed. So I'll stop there, and I know there's some content in the literature that has been provided, but happy to take any questions, or if there's anything that I share that may have led to more questions, please, happy to hear those as well.
Before you go, thank you, Baljeet. There's somebody on the line. I want to make sure that we honor the process. Person on the line, if you'd like to make comment on item 4, please press *3 now so we can recognize you. *3, and I'll give it a few seconds. All right, I don't see a hand, Commissioner, so it's all on you.
So thank you. So I had several questions for. First, I think we did work with HMA before in the past a number of times, right? And I believe that I always found their reports very satisfactory. But I thought it might be good for the commission to understand some of those. Am I correct that they did the Healthy San Francisco analysis?
Correct. They are not unknown entities, so they are known entities to DPH with multiple reports. I know in 2006 they partnered with us, as well as 2010 with both a report to prepare the San Francisco Department of Public Health, and then what wasn't yet the Health Network, but was a key component of their recommendation to prepare us for the Affordable Care Act, as well as Healthy San Francisco. So yes, they certainly have partnered with DPH to, as you recall, Commissioner Chow, with reports of, and certainly help influence and guide us to be continuing to evolve with the industry.
Right. So I find it encouraging that we've actually been able to engage them. So my question is sort of related to both item 4 and 5. How is the work that they're doing going to be different from the work of the Health Services Advisory Group, or how do they collaborate so that all of this will mesh? If we're on this side, thinking of the strategies and the ways that the system should be set up and all, and yet also what has to be done in order to meet recertification. How do they integrate or work with HSAG in order to be sure that there is some smooth operational interface here?
Absolutely, that is a phenomenal question, Commissioner Chow. Thank you for that. So, for again, HSAG, Health Services Advisory Group. Now, partnering with HSAG and HMA, as I've talked about, will focus that the comprehensive assessment, including care plans, physician services, admin, infection prevention control, the whole gamut. And so while they will be focusing on that, HSAG itself are the CMS regulations and quality experts. So the partnership and what we've seen to date, as both organizations have really demonstrated a remarkable level of partnership and choreography in the service of Laguna Honda and the Department of Public Health. HSAG will be working in collaboration at, again, as the CMS regulations and quality experts with HMA as their recertification vendor partner to ensure that Laguna Honda is well prepared for recertification. So again, the components are we're having really HSAG continue to help boots on the ground, coaching, real-time rounding, ensuring that we are, as we find opportunities and we find areas of focus, we are continuing to learn from them, receive their coaching, implement that to affect these changes in a sustainable way. So then that as we are going through the recertification process and the top to bottom assessments that we're seeing from HMA, that they all work in concert together.
So now that I sort of understand where the two are coming from, there needs to be an integrating body. And if I remember from the org chart, it looked like there was an executive committee looking over this entire recertification process. But where do you think this interface will be practically? Because it almost, I mean, it isn't one that a report comes out and over here another thing is happening, right? This is kind of simultaneously, these things are going on, and it will require an integration to be most effective. So what is that integration, which is the department's responsibility?
Absolutely, and I will get into some details, but I also will let me know, Commissioner Chow, if I'm going too far into details and you've heard enough. As you know, we have stood up the incident command structure at Laguna Honda, and the incident command structures for the rest of the team in this call, in this meeting. That is a structure that is stood up in the event of a urgent, emergent crisis or something that requires the full focus of an organization solely focused on resolving that issue. So the incident command structure has been stood up with the focus of recertification. Now that incident command structure is a structure that includes multiple sections. So an area of focus on planning, which includes our quality team, a legal section, an operations section, a finance and logistics section, and then a care experience, which is our staff engagement, recognition, patient experience section. Now, the leaders and myself, I think I broke etiquette earlier. My day job is the Chief Operating Officer of the San Francisco Health Network, but in this current capacity, I'm Incident Co-Commander of the Laguna Honda recertification with Troy Williams as the Health Network's Chief Quality Officer, my co-commander, and with Roland Pickens as our executive sponsor for this effort. And now within that structure, the recertification is really the nucleus or the soul of what our effort is. HSAG and HMA are a key component reporting in through the operations component of that branch. And now the next question would be, how does that structure integrate with the Laguna Honda executive staff? How are they what is the integration here for the local team plus the incident command structure? So we're proud to say that most, if not many, well, actually, yeah, most of the leadership positions in the incident command structure are being populated by and filled by the Laguna Honda executive staff, plus many of the extended executive staff, which are the director level personnel. And so knowing that now we have the integration of how the organization is integrating in the Laguna Honda incident command structure, your question is, how is HSAG and HMA working in concert, which is the responsibility of the Department of Public Health to really ensure. So within this structure, we have focused daily incident command report outs. We have several standing partnerships and dyads and meetings where we're tracking the work. We are partnering and work on the floors rounding. And the HSAG and HMA teams, effective tomorrow, but informally to this date, have been or will be presenting their findings as part of the report out of the team, so that the objectives and the findings and the focus of HSAG and HMA through our PDS8 and process improvement process, their objectives are influencing the objectives of the operations section, of the planning section, of the logistics and finance section, and of the care experience section. So our goal is that their objectives, as they're tracked, are continuing to move forward. Their goals align with the goals of what we're all working in concert towards. So at the end of every operational period, which is a 7-day weekly period, we're able to reflect and see how we move the dial in the recertification. I'll stop there. I do have a metaphor or analogy to share with you about painting walls, but if that, I will stop and I can jump into that one if you'd like, but if it wasn't clear.
No, I think that helps clarify, and actually you've answered also the other question: how does that integrate with the everyday staff that's really involved with the various operations? And I could see that a lot of thought has gone into basically integrating the incident command leadership with the leadership of the hospital, so there's no conflict there, and how you're bringing the work of these two contractors together to your, if I'm stating it correctly, to the working staff, therefore discussing what tasks need to be done and how to do it within an overall setting of everybody, so that these aren't just isolated reports going on. And meanwhile, there's a line of command over here that's doing whatever they're doing. So
yeah, we don't want silos, and we even, while islands of excellence are sometimes appreciated, we want to make sure we're an entire organization of excellence. So I appreciate you sharing that, and we are certainly evolving at daily. We get feedback from our frontline staff. We're getting feedback from our patients as we are, set up the incident command structure in our main areas of care and near the cafeteria. So we are constantly evolving. So thank you for recognizing that, Commissioner Chow. But I also hope that we will continue to improve and be better tomorrow than we were yesterday.
well, no, thank you, and you've helped put into perspective, I think, both of the contracts for me. So I appreciate that. Madam Chair, I don't have any other questions.
Thank you. And do we have a motion then?
If you have no other questions, then I'm happy to make the motion. I think we need this, and I'd be happy also when we get to the second contract to make that motion.
Yes, I don't want to risk going into the analogies of like painting walls.
No.
So commissioners, let's stay on item 4, which is the HMA contract, just so you can take it item by item, and please do the motions for that.
So I will motion for item number 4.
Okay, and I'll second the item. And do we have public comment on that?
First on the line, if you'd like to make comment on item 4, the HMA contract, please press *3 now. No hands. So thank you, commissioners. That item will move forward to the consent calendar. And then how about item 5, the Health Services Advisory Group contract?
I will make a motion for item number 5, the Health Services Advisory Group contract. Yes.
Okay, and I'll second.
And first on the line, if you'd like to make comment on item 5, the contract is Health Services Advisory Group. Please let us know by raising your hand. Please let us know by pressing *3. All right, no hand. So both of those items move forward. Thank you so much, Baljeet, and I'm sure we'll see you in the meeting sometime soon.
Thank you all.
Thank you. And Commissioner, noting it's 3:30, so we're tight on time, and we have to get through this to get before the meeting. So item 6 is the contract request with Royal Ambulance. Glenn McClintock. I do not see you on the. Ms. Ruggles, I don't see Glenn here. Or someone else? Can someone else possibly present this?
Well, good thing I'm here. All right, let me open this up. Okay. Can't really tell you much more than what is on here, but if it's not, like, if this is problematic, we can go back. But so this is request for approval of a new contract with Royal Ambulance to perform ambulance services, and the total proposed contract is $3 million, including a 12% contingency. So it would start the term 6/1/2022 through 6/30/2026. I'm trying to. So the contract, what they're going to be providing is as needed basic life support and critical care ambulance transportation services for clients and patients at or involving the return to the general hospital, Laguna, and community clinics or contracted service providers as needed. So this Royal Ambulance was selected through a solicitation process, and they were the highest ranked sole proposer. And the RFP itself allows for 9 years, which includes contract options.
I think my question is probably answered, but this is then fairly, this is for not elective, but scheduled transportation, it looks like, rather than from a home to a hospital. Is that correct? Because it leaves out advanced life support.
I mean, that seemed like a very logical conclusion. I think I'll need to, without having that person, let me see if I can email someone quickly.
And then it is as the transport is needed, right? Yeah, it says actual.
Okay.
And I'm wondering if it's possible for Ms. Ruggles to get this answer and convey that to me so that when you all do this, the full commission meeting, there's time, because there's not a lot of time for us to do this now.
Oh, that's perfectly fine. I mean, even if that's all it was, it's a clarification. It's important to really tie down ambulance costs.
Sure. Ms. Ruggles, can you text me or email me that info once you get it?
Right, which is it on call?
Commissioner Tubb, can you clarify the question?
Is the vendor on? He should have received Ryan Whitmer.
Oh, sure. Yes.
There you go. I was trying to chime in there. Yes, this would be for just BLS and critical care services. This would not include advanced life support or transports coming from a home to the hospital or anything like that.
Okay, no, thank you. That's fine, and thank you for offering the service and winning the bid.
Absolutely. Thank you. We're excited to be here.
Great. That's a quick answer.
Okay, and if the chair is willing to entertain a motion to accept, to recommend the contract.
Yes, and so there's a motion, and I'm seconding the motion.
Yes. Yes, thank you. And there's no one on the line now, so that can move forward. We can move on to item 7, which is a request for a new contract with the Regents of California, UCSF for obstetrics, gynecology, and reproductive sciences to provide the city and department. Well, that's enough. And I believe Ms. Raganold is here to present.
Hello, commissioners. My name is Emily Raganold, and I am a health program coordinator with Behavioral Health Services. I am here today to give a brief overview of the requested approval for a new contract with UCSF Department of Obstetrics, Gynecology, and Reproductive Sciences for the Team Lily program. BHS was recently awarded federal funds as an expansion of the Substance Abuse Block Grant, or SABG, through the Coronavirus Response and Relief Supplemental Appropriations Act. We would like to award Team Lily with $237,350 for SABG perinatal services for a 16-month contract from March 1st, 2022 through June 30th, 2023. We are requesting a 2142 sole source contract, as Team Lily is the only vendor poised to begin providing these services within the grant period of July 1st, 2021 to December 31st, 2022. Some more information on Team Lily. Team Lily is a Zuckerberg San Francisco General Hospital-based multidisciplinary care team providing person-centered, trauma-informed wraparound services to pregnant and postpartum people. They support pregnant people experiencing significant barriers to accessing clinic-based prenatal care primarily those experiencing homelessness, substance use disorders, incarceration, intimate partner violence, and/or mental illness. Team Lily is also an active collaborator with other DPH and DPH-funded programs. These specific funds will support the salaries of various employees, including 2 patient navigators. These patient navigators are responsible for ensuring patients' immediate needs are met, including assistance with navigating the shelter system, accessing services through the Women, Infant, and Children program, accessing food, clothing, and baby supplies, as well as accessing opiate treatment programs and residential or outpatient treatment services. The specific UOS for this contract are patient encounters, including counseling and education, case management, coordination with other providers and programs, evaluation, prenatal care, substance use treatment, and other services. Their unit to service delivery goal is 67 encounters over 6 months. Finally, their target population for these services are pregnant people in San Francisco facing significant barriers to effective prenatal care and support services. Please let me know if you have any questions and I'll be happy to answer them. Or if I do not know the answer, I will circle back with my colleagues and provide an answer to this committee as soon as possible. Thank you.
Commissioner Chow?
So in the program, it is that there are 67 clients. Is that is that correct, or it says 67 staff hours? So I wasn't quite sure.
Yeah, so the 67 correlates to the units of service, which is staff time and encounters. The unduplicated clients served per 6 months is 10.
Oh, I see. Okay. And it's only a 6-month program for them?
So the funding would start March 1st, 2022 and go through December 31st, 2022. We had the contract go through June 30th, 2023 in case there were costs incurred after December 31st, 2022. And that's because our SABG funding ends December 31st, 2022.
Oh, I see. I see the split here. Okay, so actually in a given year, there's 116 people, and the second half is the 67. Okay.
Correct.
All right, got you. Okay, thank you very much. I don't have any other questions.
And I have one. What this is just a curiosity of mine. So, does Team Lily also provide linkages to like postnatal services?
Anecdotally, I believe yes, but I'm happy to follow up with the medical director to provide you an exact answer.
Yeah, because like, you know, because like it says here prenatal to perinatal. So like, what happened after? So you know, like yeah, yeah. Thank you.
So I'll make a motion for acceptance.
And I will second.
Thank you. And we can move on to item 8, which is chapter 21.42 sole source waiver pre-approval list for fiscal year 2022 to 23.
Hello, commissioners, I'm back.
Welcome back.
Thank you. I'm happy it's you two that have been through this and know this. In the years ago, and we could resurrect it. We did a whole PowerPoint presentation, but hopefully it's kind of old news at this point. This is the annual memo where we ask you your permission, your approval of a pre-approval list, which would allow us. This is part of the San Francisco Administrative Code, Chapter 2142, which we use as shorthand to say the sole source. But when we need a sole source approval for our professional services agreement, usually it's because we have not completed a solicitation, but there's criteria. Sorry, I'm babbling, but anyway, we have this every year. And what you're approving is a list of our existing contracts. And in the event that we do get additional funding and need to exercise a sole source agreement. And so by pre-approving this list, you're actually really helping to expedite the process, because what you're doing is pre-approving a list saying, if you do need to, if you get new funding and you do need to expand a contract or a new contract through a sole source agreement, then we're giving you the pre-approval. And then what happens is we, make sure it meets the criteria, obviously, and we create the contract and we bring it to the Health Commission. So if it becomes a contract, you'll see it. And then when we go to purchasing, we can upload your pre-approval. And so that actually is a huge, I'm not using my verb correctly, expediting the list quickly. So there's not additional paperwork and signatures that they require. So this pre-approval allows us to expedite the process. You do get the contract if we actually enter into one. And then the last thing is, every year we as a department are required to submit, we call it the Sunshine Report, but it goes to the Board of Supervisors, and it identifies all the 2142 sole sources, actually all our sole sources that we used in the past fiscal year. So you also get to see a list of what we actually used, because right now what you're approving is a list of all of our contracts. And we added, there's some new ones that were added to the list. And of those new ones, Booker T. Washington, Marin City Health and Wellness Center, and Southeast Asian Development are actually recently selected under a solicitation, and we haven't developed the contract yet. So we added them to the list in the event that more funding gets added during the year. And then the American Indian Cultural Center and the Indian Education Program are not vendors that we have. However, during this past year, these two vendors came up in the context of a Board of Supervisors add back. And so it's really just, if you will, quote, insurance, because we're doing a solicitation for those services. And these vendors may or may not get them. But anyway, we're doing a solicitation, but I just thought in the event that it came up. But otherwise, everything on here is an existing vendor, and you can see the breakdown of how we have typically are currently using that vendor, which section and DPH.
So I see here that CPMC is not a current contractor, but keep on list.
Right. So occasionally we'll have vendors on the list that we had a contract with, or we, like things come up. And so it's just precautionary. And again, I know this is kind of a weird concept, but it's in advance approval in the event that we need to tap into one of these vendors. It just expedites the process. But the reality is most of these, the majority will never receive a need for a sole source.
Okay. Commissioner Chow, do you have any questions?
No, I remember when this list was developed, and it was very helpful, and so I would move its recommendation to the commission.
Yes, it's like a long lost friends returning. So yeah, and I'll second.
Great. Item 9 is emerging issues. Hearing none, we can move on to public comment, which there is none. And so consideration for adjournment, commissioners, please.
Okay, and I would move to adjourn so that we can rest for a few moments.
And I'll second that.
At least you all can. I have to run in the room. Thank you, everyone. Thanks, Ms.
Bye.
Russell.
Thank
Everybody
you.
for staying on the line. Bye-bye.
Okay, thank you.
Thank you.